Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Thank you very much to the Master of Ceremony and the moderator for that very kind introduction. It is an honor for me to be at the Congress today. Unfortunately, I have to be presenting online, but that's okay. I hope everybody will be able to hear what I'm going to try to embark on you on the theme of Vision Zero. Ladies and gentlemen, my name is Azlan. I am the head of prevention, medical and rehabilitation division of PERKESO, or the Social Security Organization of Malaysia. As a social security organization, we see the brunt of occupational injury every day in our daily work. But most of the times, people think in social security that it is all about compensation and all about the payout from the injury. But we also believe that the best form of social security is to stay healthy and to stay safe. Therefore, prevention of accidents, especially accidents at the workplace, is one of the priority that we have as a social security organization in Malaysia. I also happen to be part of the Technical Commission on Social Security against Occupational Injury, as well as prevention against transportation accidents in the ISA, or the International Social Security Association, of which you will hear or see a lot if you are embarking into Vision Zero. And for that, ladies and gentlemen, let's just have a look at the slide which I have prepared for the presentation today. Vision Zero in Malaysia. Ladies and gentlemen, the same as in everywhere in the world, we have seen that there is a decline of occupational injury and occupational accidents everywhere. And this has happened for the past maybe 6 or 7 decades ago, where we can see that there's a good decline of the occupational accidents everywhere. And this happens because of the development of safer machines or machine safety, and also development of safe systems at work. Therefore, many companies embark on the OSH management system. Many take aboard the ISO 45,000, for example, or the ISO 18,000 before, of which companies and workplaces look into making the workplaces safe. But as you can see right at the end of the graph here, over the past 1 decade or slightly more than that, the line or the number of accidents have been plateauing, or it goes into a straight line. It doesn't come down anymore. And this has raised a concern. Why is it not coming down anymore? Because accidents are still happening, fatal injury among workers are still happening. We have brought it down, but we are unable to bring it down even further. And this concerns relates into the next stage of occupational safety and health. So many of the organizations, nations, as well as companies looks into how we can go into a culture of safety. Basically, if you see the bottom part of the picture here, there's been a lot of movement that we look into proactive or reactive to make the machine safer and also make the workplace safer by introducing rules. But to jump from that situation to make workers and employers to be more proactive, or to have a culture of safety at the workplace that will bring down the number of accidents even further, it seems that we are stuck, or we hit an invisible barrier. So how do we get past this invisible barrier? Now, I know many people have introduced safety and health culture. Many people has looked into how behavioral safety can be embarked. But after a decade of plateauing or a decade of straight line, there must be other ways. Therefore, the area or the aspect that we have looked into is that maybe we need to look at it into a different perspective. And this is what we call or introduce as Vision Zero. What does it mean, Vision Zero? Ladies and gentlemen, when we look at Vision Zero, when people improve or when the Vision Zero movement started, there's a lot of questions and challenges asking why zero. You can never achieve zero, or it is an impossible target. Well, this is not a target. This is not a KPI. This is a vision. And the vision says that no accident should happen. The vision says that no fatal accidents should happen. The vision says that workplaces should be healthy and promote well-being. So Vision Zero basically means that we do not accept that accidents should happen at the workplace. We do not accept that this is something that is not preventable. So the philosophy of Vision Zero is that we wanted to embark into people, into everybody, that this is not acceptable. Therefore, all occupational accidents, all harm and diseases that can happen at the workplace are something that is preventable. I can challenge you. If you do not think that your vision is zero, I think your vision is actually zero, which is why you are here at the Safety and Health Conference, to look into how can you improve your workplaces so that you can bring down the occupational accidents and occupational diseases at your workplace. How low you want to bring it down? Do you want to bring it down to one accident? Is that acceptable? When you look at your colleagues at the workplace and you see that one of you are going to have an accident this year, is that acceptable? No, right? Because when you look at your colleagues at the workplace, you think that all of them should be safe and should not have an accident. That's why you are here. So whether you like it or whether you know it, actually your vision for occupational accidents and diseases at the workplaces are actually now zero. So we wanted to get a ball rolling so that people come into this movement to not accept accidents and harm and diseases at the workplace, and to say that these are all preventable. There are things that we can do to make it not happen. There are things that we can do so that it is something that is not considered a norm. So Vision Zero is also a process. It is not a target. We are not talking about zero accident. We are talking a process so that we can achieve zero accidents. This is flexible. Therefore, in the movement of Vision Zero, you are welcome to all visit the Vision Zero Global website. It is a flexible, transformational approach to prevention. So we wanted to look at it differently. We have seen the safety in machinery safety. We have seen the occupational safety and health management system. But now we wanted to say, look, let's build a culture that, we do not accept accidents. Everybody come to work, go back from work safe. Building a culture of prevention is important. It integrates both safety, health, and well-being at work. So the moment when we talk about Vision Zero, ladies and gentlemen, number one, we speak about a global movement. And number two, we speak about it as a vision of something that we want to achieve, and therefore we must believe. Everybody here in the conference must believe that all accidents, all diseases, all injuries that happens at the workplace are preventable. This is important. So there you go. We believe in Vision Zero, and it is something that needed to be brought over as a different perspective in safety and health. So ladies and gentlemen, you are all welcome. Go to Google, just type in Vision Zero or type in Vision Zero Global. You'll be brought to the Vision Zero website where you can use all the resources that are provided for free, including also registering yourself as a Vision Zero company. I did not produce that video just now. That video is made available for anybody to use to promote the Vision Zero movement or to promote the Vision Zero philosophy to all workplaces. Now, to achieve a zero philosophy, Vision Zero movement introduce 7 golden rules. Now, the 7 golden rules are familiar with anybody or everybody who are in the safety and health area. In all safety and health management, we say that the leadership must demonstrate commitment, must allocate the resources, and must show that safety and health at work is important. So that's golden rule number 1, take leadership. Golden rule number 2, you must identify hazards. Everybody here knows how to do a hazard control and risk assessment. So that must be part of the golden rules or part of the things that must be done so that we can truly say we are going towards zero as a vision, so that we can truly say that we do not accept accidents, because accidents are preventable. To prevent it, you must know how to control and identify hazards. Vision Zero golden rule number 3, define targets for your programs and also looking at a safe and healthy system to be developed. So you define the targets for your programs, who are at risk, therefore your programs can be something that is objectively use the resources and hit the targets of what going to be in part in safety and health, but also to have a safety and health system that it needs to be organized and not done haphazardly. Golden rule number 5 is, of course, to ensure safety and health in machines, but not only machines, also at workplaces, which we are used to. Number 6 and 7, we look at the improving qualifications and also investing in people. So these are the 7 golden rules. It is not my intention today to share with you each part of the rules, but this is all available as a resource when you want to follow through with a Vision Zero campaign at the workplaces. It does not dismiss your current safety and health management process. It does not dismiss your current rules and regulations for safety and health, but what it does is you look at how your rules and regulations and your systems fit into the golden rules, and then we impart to our workers and also our managers that we do not accept accidents at the workplace. This slide is old. At the moment, Vision Zero have already reached more than 12,000 companies registered in the world. Vision Zero is not a movement by Malaysia or by any other countries that you know. We are quite sure that Vision Zero has been very visibly broadcasted in the recent World Congress of Safety and Health in Sydney, Australia. Vision Zero exists everywhere in the world. Now, Vision Zero, you can actually see, of course, in Malaysia, we are quite heavily invested into this, but you can see Vision Zero in Thailand, you can see Vision Zero in Singapore. We have just had a joint seminar with India for a Vision Zero in India and Malaysia, and we're going to have another one, a joint seminar in July to showcase what activities has been done by companies to support Vision Zero in both Malaysia and India. Vision Zero is ever present in Europe. It's very strongly advocated in Germany, in United Kingdom, in France, in Austria. There is a strong Vision Zero movement in agriculture in Poland, for example, which is also something very popular and showcased a lot in many of the Congress in safety and health. Vision Zero is present in Africa, Zambia, Ghana, Cote d'Ivoire, all strong countries who have done their national launch and also African launch of Vision Zero. So ladies and gentlemen, I am sure even in Brunei, you are also seeing the same pattern that we see, that we need to have a different perspective into looking at safety and health, and this is one perspective which are now being used by many countries in the world, and also thousands of companies in the world. Do not be surprised, in 2025 in the World Expo in Japan, there's going to be a dedicated session towards Vision Zero and safety and health. So that is how far Vision Zero have been introduced around the world until today. So let's get back to where we are in Malaysia. On the slide at the moment, I am showing you the National Plan for Safety and Health for 2016 and 2020. I'm showing you this because Malaysia launched Vision Zero in Malaysia in 2019. Therefore, this is the relevant plan at the time. And the plan was to actually achieve a occupational safety and health culture in the workplace. And this is also another way or another movement when we have reached the stage of plateauing of our occupational accident. So we wanted to go into safety and health culture, but it's not gonna work, and we realize it cannot work if we are still doing the same thing. Therefore, we need to look at a different perspective. This is what I'm trying to show you. This is total number of reported accidents to the Social Security, looking at occupational accident or industrial accident as well as commuting accident. There is some activity in 2020, 2021 and 2022 that is due to the COVID-19, of course, of which businesses shut down. Therefore, the numbers suddenly drop, and then it go back up once the businesses are open back in 2022 and 2023. But what is even more important for us actually is if you look at the line of accidents, both industrial accidents and commuting accidents, especially industrial accidents, which is the dark green, for the past 13 years is almost a straight line. We have done very well from 1990 to 2010, of which we have reduced the number of accidents down to almost around 32,000 cases per year for all workers in Malaysia. But for the decade following that, there is a real stagnant. We are not able to push it down further, and this is, we think, is due to occupational safety and health is not imparted as a culture or as a behavior. We need people to believe that accidents are not something that you cannot avoid. It is something that you can avoid. So we have done a lot of things. We have done a lot of intervention initiatives, limited reach. Therefore, we need to introduce Vision Zero. So Vision Zero, this is the introducing the idea. It was a global launch of Vision Zero was done at the World Congress of Safety and Health in Singapore in 2017. Before that, it was initially introduced during the World Congress of Safety and Health in Frankfurt in 2014. In 2019, 2 years after the global launch in Singapore, Malaysia took the step and have our own national launch of Vision Zero. And after that, we did not stop because activities after activities was conducted to embark and impart the idea of Vision Zero into Malaysia. Now, we did not do it in Social Security and also in our partners in safety and health. We did not do it haphazardly. We actually had a strategy or a deliberate methods of trying to deliver Vision Zero in Malaysia. Ladies and gentlemen, 3 strategies. The first one is promotion and awareness. Second strategy is on improving literacy and resources. Third strategy is on field implementation. So we need to make sure that people are capable or know about Vision Zero in Malaysia. Just like you today, who might have heard of Vision Zero, but many may have not. But the same with us, we are also at the beginning, we'll try to create the awareness of Vision Zero in the world. So we look at Vision Zero as a focus for all seminar and conferences held by PERKESO. At the time, if you call us to give a talk or give a workshop on safety and health, we always talk about Vision Zero. That's it. Even today, if there is a main presentation in a large conference or a small conference in Malaysia, if they invite us, we shall still give the same presentation about what Vision Zero is and why we want to embark into Vision Zero. So we also co-branded Vision Zero in all our initiatives in the country, and we promote the recruitment of Vision Zero partners and Vision Zero companies. Ladies and gentlemen, all of you representing your company can register yourself into the movement as a Vision Zero partner or Vision Zero company. There are different roles between the two. You get to choose. All you have to do is go into the Vision Zero Global website and register as a partner or companies. You get a lot of information on safety and health, on Vision Zero movement, as well as use of the resources that are provided by the Vision Zero Global initiatives. Also, you can also contribute into that by providing your own materials so that other people can show. And this is very powerful because you get to share and you get to learn from all thousands of companies in the country. We look at Vision Zero as part of the first strategy to also promote them into social media and also competitions. We think that we are doing as much and as good as we can. As of November 2023, there are already 630 companies in Malaysia which have enrolled or registered as a Vision Zero company into the website. There are about 1,400 companies in Asia that has enrolled, but 600 of them comes from Malaysian companies. We like to do more, and we hope to reach a magic number of 1,000 company in 2024. Our second strategy is to also promote literacy and resources. Now, in the beginning of Vision Zero, the number of resources are also quite limited, but now there's plenty. When we embarked in 2017, one of the first things that we did is to translate the 7 golden rules, which is published in 10 languages at the time in the Vision Zero Global website. We translated them into the Malay language, so this can be used by, of course, in Malaysia and also in Brunei and all other areas in the Nusantara that uses Malay language, that to be published and also shared into the Vision Zero Global website. So Vision Zero 7 peraturan utama kemalangan sifat dan kerja sihat adalah dokumen dalam bahasa yang ke-11 di laman web Vision Zero Global. We are also keen to develop a second level documents to complement the guidelines for Vision Zero, of which then we also conduct a Vision Zero survey. These are some of the efforts that we do under second strategy to improve resources that our companies in Malaysia and legislators can use into embarking into programs under Vision Zero. Not only that, in other literacy, in other resources, we also we also integrate the philosophy of Vision Zero into this. There are modules that we produce, for example, with the Traffic Police of Malaysia. There are modules that we develop together with the National Institute of Road Safety. There are programs that we introduce and modules for industrial safety support or work-related road safety support, which are all of these, as you can see on the slide, are labeled and also imparted as a philosophy of Vision Zero. Now, we can give promotion, we can produce the resources, but we must also show that this can work on the operational level or at the workplaces. Therefore, that's why the third strategy is to do field implementation. One of our flagship program is what we call Vision Zero Community, and what we do is we go into the community, we identify areas where there are numbers of accidents higher than the most in the country. We then embark to talk to the community members, to talk to the local councils and local governments. We also looked into the surrounding workplaces to try and say, look, we do not accept accidents at these workplaces. And we did this program called Vision Zero Community, and we are very happy because actually the number of accidents in those areas that we have identified had actually came down. These are field implementation. There are a few more programs of field implementation that we did, such as what we call the Community Safety Support Program, such as the Vision Zero Secretariat that we use to get interactions between Vision Zero companies. We also conduct Vision Zero webinar series 4 times a year. Like I said earlier, in March we did one with India. There are also other activities to go on the ground and actually imparting this Vision Zero philosophy to the workers down there. Not just workers who are formal, we also look at the informal sector, we look at the P-hailing and E-hailing riders or the platform economy workers. We imparted the same knowledge and same philosophy to the foreign workers in the foreign workers safety induction. We are not talking about technicalities of safety and health, ladies and gentlemen. We just wanted to impart, first of all, everybody must understand that we do not want to be involved in an accident. You must come back safe after you go back to work. You must come back safe after you do anything at the workplace. Accidents are not something that is acceptable. This is one example, Community Safety Support Program. In I think we had reached 326 workplaces in end of the 2022, trained about 11,000 employees, of which we saw that there is 76% reduction in commuting accident, 85% showing better riding behavior, and 25% reduction in dominant negative riding behavior. This includes not wearing their helmet, this includes zigzagging between cars and things like that. So it can work. It can work if we can also show that we can go down to the ground and do these programs, not only just promoting or providing resources. So these strategies are something that we actually deliberately do and plan, so that we wanted to go beyond that invisible barrier that I showed you earlier, that from machine safety, from safe systems, we need to look into people to make them believe that accidents are preventable. This is an example of our strategic planning. What I've shown you earlier was part that is on the left, the prevention and health promotion for 2020 and 2025. These are the things that we've done for the Vision Zero campaign. But we are already thinking, what are we going to do for the next 5 years after 2025? And this is going to be more in that program, plus possibly a larger outreach for the programs that we've done earlier. So I'm not trying to say do the programs like what we do, but I think it is very important for such a new philosophy or such a different perspective in safety and health, of which we wanted people to believe that this is not acceptable, rather than relying on the enforcement, relying on the resources put on machines. We wanted to say that people must believe, and for different perspective, for a actions, so that people look at it differently. Legislators, ladies and gentlemen, management, safety and health officers, do it, but do it strategically. We try our strategy, you also do it strategically. Do not do it haphazardly. So the last question that people ask, can we change? Can we all here believe that accident is something preventable? Can we all here believe that the vision for the number of accidents that happen in your workplace must be zero, not 1 or 2 or 3, zero. We want to achieve that. How can we change that? I don't know, but I can share you 2 examples. This is from Victoria State, Australia, 30 or 40 years ago. If you drive and also drink, it's considered part of masculinity. Road crashes are common, and what the authorities in Australia did was they did decades, ladies and gentlemen, not 2 years, decades of campaigns against driving under alcohol influence. And now, if we go to Victoria State, Australia, I've been there, and which is why I take this example. Death due to road crashes are not acceptable. It happens, it still happens, but it is not acceptable. Drunk driving is a serious offense. Therefore, speed limits are set to prevent serious injuries. Drunk driving inspection are done regularly, accepted by the people there, because road crashes, death due to road crashes is not acceptable. After decades of campaigning, the vision, if you ask them, you have asked anybody of them, how many deaths do you accept on the road crashes this year? They will definitely tell you, no, we do not accept any death. It must be zero. Well, when I show this to the audience in Malaysia, they say, wow, that's Australia, this is not Malaysia. Well, ladies and gentlemen, I'm also a medical doctor. 30 years ago, or maybe now 40, because this was an example from when I was still practicing. Maternal delivery is considered a life and death situation. Maternal death is common. It's part of life. So mothers supposed to sacrifice their life to give birth to their new life. But decades, again, ladies and gentlemen, decades of changes in health facility and healthcare now changes the mind of the people. Maternal death is not common. It is uncommon. If there is any death that happens during delivery, each case is treated seriously. Every maternal death is investigated and root cause is identified. In my practice, I have seen policy changes are made based on 1 or 2 cases, because it found that these cases, these deaths must not recur. Over decades of pushing for this in Malaysia, if you ask anybody, ask any husbands or any parents, if their daughters or wives are going to deliver, what is their expectation of the success of the woman after delivery, and their answer will be the same. She will come home safely, because the vision for death from maternal delivery is zero. We can do it in Australia. We can change in maternal death in Malaysia. definitely, if we do it well enough, if we do it strategically enough in Malaysia, in Brunei, we shall see one day that when people talk about death at the workplace, it is not acceptable. People should not die. People should not die doing their job. So don't wait. Do not create any excuse. Let's look into this. Let's look into ways so that we can further reduce occupational accident and occupational diseases everywhere in the world. Join the bandwagon. We are always here ready to answer any question. You can also Google yourself into Vision Zero Global, and you'll find there are many resources that can be tapped into this. Join seminars, webinars, conferences, activities relating to Vision Zero. There are many competitions also being held. Look into materials, produce your own materials so that at one day we will have workers and employers who believe that accidents are definitely preventable, diseases are definitely preventable, and well-being of the workers is paramount. Thank you for your attention, ladies and gentlemen. I'll go back to the Master of Ceremony for further question and answers. That should be my last slide. Assalamualaikum warahmatullahi wabarakatuh.